Hello students, so let's take a look at the spinal cord and let's take a little quick overview of how it sits in relation with the vertebral column. So it runs from the foramen magnum, that's the large opening at the base of the skull, and it runs down to the level of the first or second lumbar vertebrae. It is a major reflex center, and you have ascending and descending tracts. The ascending tracts are primarily sensory, carrying information up the spinal cord. Descending is going to be obviously motor. So here's an overview of the spinal cord, where it runs. Here's the base of the skull, and as addressed a second ago, it runs from the opening, from the foramen magnum, all the way down to the first or second lumbar vertebrae between L1 and L2. That's where the spinal cord pretty much ends at an area known as the conus medullaris, which is right about here. Overview of the anatomy of the spinal cord. You have a couple of grooves. You have a posterior median sulcus. You have an anterior median fissure. This is the groove where you have the anterior spinal artery that courses along that anterior median fissure. You have a couple of enlargements, a cervical and lumbar enlargement, and you have the conus medullaris. That's the conical end of the spinal cord. I'll show you a picture of that in a bit. Filum terminale, that's the posterior extension. That's the posterior extension of pia mater. Of pia mater. I'll show you a picture of that to illustrate it better. You have your dorsal and ventral roots, and you also have the dorsal root ganglion. That's the part that has the aggregates of nerve cell bodies in the peripheral nervous system. Then you have the 31 pairs of spinal nerves, and you have the cauda equina. That's the mesh of spinal nerves that come off of the conus medullaris, and eventually this network of nerves will enter into the sacral canal. So here's a gross depiction of the spinal cord. Here it is right here, and it comes to an end. It narrows down into a conus medullaris, and then as you can see here, here's the collection of nerves, the cauda equina, or the Latin term for horse's tail, running caudally to enter into the sacral canal. Then you have the filum terminale, that's the extension of that pia, running all the way down towards the coccyx. Here's a composite showing you the safest location to administer a lumbar puncture to collect CSF. So CSF runs here in this subarachnoid space, and the needle has to obviously traverse first through the skin, then go traverse through the subcutaneous adipose tissue, has to break through muscle tissue, then you have to go through the ligament here in between these spinous processes here. SP stands for spinous process. Then it has to go in between the adjacent vertebrae, and then pierce the ligamentum flavum, which is this right here, this ligament, or they call it yellow ligament. Then it has to go through the epidural space, and then here is your target site, the subarachnoid space, to collect the CSF for diagnosis or testing. Here's a cross-sectional view of the trajectory of the needle, and again, you simply just want to make sure that you know the order of structures, and they're all listed here in this area. So the course of the lumbar needle goes through the skin, then it goes to the subcutaneous tissue, has to be in between these spinous processes, and the lamina, number 4. So all these items here, folks, are all numbered for you. That's 1, that's 2, okay, and so forth. And then you have, then it has to, you have to pierce the ligamentum flavum, and then you have to bypass the epidural space, which is right about here, and then you're, and then you have to go down to the part labeled 8. That's your target site, the subarachnoid space. All this is subarachnoid space right about here. Okay, just make sure you know the order of structures as you are introducing a needle into the patient's back to collect CSF. Okay, now the meninges, it is a 3-layer arrangement going from outermost to deepest, or innermost I should say. Dura arachnoid pia. It is continuous with the cranial meninges that occur in the cranial cavity. CSF, you have that in the subarachnoid space. And you have in epidural space. What you will find there is pretty much a good amount of adipose tissue to cushion the spinal cord. Function as a cushion for that. And again, here's a diagram showing you the breakdown. So here's the dura mater, here's the arachnoid mater right here, and then you have the pia in intimate contact with the spinal cord. Here's the location of the anterior spinal artery running through that fissure, that groove in the anterior part of the spinal cord. Dura mater, outermost covering of the spinal cord and the brain. It fuses at the margins of the foramen magnum, and the coccygeal ligament merges with the components of the filum terminale, and that will attach onto the coccyx. Then you have your arachnoid. It's squeezed in between a subdural space. So if you go back to this diagram here, here's the dura, here's the arachnoid, and then you have this area known as the subdural space there. Okay. Then you have the arachnoid. That's the middle meningeal layer, and it's covered by it's lined by a simple squamous epithelium. It's one of the basic tissues. And then you have your subarachnoid space, obviously, that has not only CSF, but also has some of these collagen fibers. The pia mater is the innermost layer. Again, it is in intimate contact with the anterior and posterior spinal arteries. The surface of the spine of that pia mater, it has astrocytes that reinforce the pia mater in place. You have the denticulate ligament. These are lateral extensions of the pia, right? That reinforce or anchor the spinal cord laterally, and then the filum terminale is the posterior extension of the pia, and that will also fuse with the dura in this area here known as the filum terminale to form. So you have filum terminale plus the filum terminale plus dura, and what that gives you is the coccygeal ligament. Let me write this better, folks. Hang on. So filum terminale is simply, it's what it is pia mater plus dura, and then you end up with the coccygeal ligament. Okay, and then if you look at this picture here, shows you the dura being reflected. You can see evidence of the denticulate ligament here, very thin tissue, somewhat translucent. That's the denticulate ligament. That's simply extensions of pia, lateral extensions of pia. And it kind of reinforces, it suspends, it kind of anchors or reinforces the spinal cord laterally, and then you have the filum terminale that will converge with the dura to form the coccygeal ligament and anchor onto the coccyx posteriorly. Cross section of the spinal cord, you have gray matter and you have white matter. So the gray matter, you have dorsal posterior horn, you have anterior horn, lateral gray horn. Now the dorsal horn is the area that houses the somatic and visceral sensory neurons. You also have interneurons there. The anterior or ventral gray horn, you're going to have somatic motor neurons there. And then in the lateral horn, it's limited to the thorax and the superior lumbar segments, and it contains nuclei, visceral motor nuclei, or these motor nuclei are connected to the visceral efferent fibers. And then you have your great commissures, and I'll show you what that is. So here's a picture showing you you have the dorsal horn here, posterior horn. You have your lateral horn right about here, and your anterior horn. And here are your great commissures that allow for communication between the two sides of the horns. And that's about it for that information there. Then you have your white matter. So you have gray matter. Again, we're looking at a cross section of the spinal cord. So this is posterior and this is anterior. Okay. White matter. You have columns, anterior and posterior columns, or they call them also funiculi. You have a white commissure also. You have columns laterally, and you also and what I want you to also keep in mind that you have ascending and descending tracts. We're talking about what are tracts? Tracts are the axons. You find them within the spinal cord. Ascending tract is sensory information. Descending is motor. Okay, so we go here. Again, you have your posterior columns, anterior columns, anterior funiculi. Okay, and you also have here white columns on the lateral aspect of the spinal cord. Now, in these ensuing slides, what I want you to be able to do is make the distinction between what is cervical segment, and you also have your motor neurons for the innervation of neck muscles. You also have motor neurons for the innervation of upper limb muscles in the cervical segment. Here's a thoracic segment where you'll have motor neurons for the trunk muscles, and you also have the lateral gray horn. So as was addressed earlier, the lateral horn is limited to the thoracic segments of the spinal cord and the upper lumbar. This is lumbar, and here you find now motor neurons for the trunk muscles and motor neurons for the lower limb muscles. And this is sacral. Here you'll find motor neurons for the trunk muscles and motor neurons for the lower limb muscles. Now, here's a composite of a spinal cord cross section. Notice how you see here in the dorsal column a fasciculus gracilis and cuneatus. So notice how you see fasciculus gracilis you see cuneatus only in the cervical and in the thoracic. Cuneatus here, cuneatus here. Now, what this is, this carries information, proprioceptive information for the upper trunk, upper trunk. Actually, cuneatus, yes. What this carries the information is for the upper trunk and the trunk. Again, it's carrying proprioceptive sensory information, proprioceptive or sensory information for the upper trunk and the upper extremities. Fasciculus cuneatus, okay, cervical and thoracic, okay. Okay, notice how once you get to the lumbar, you have no evidence of a fasciculus cuneatus, okay. So again, the cervical and the thoracic has a fasciculus cuneatus, which carries proprioceptive information of the upper trunk and the upper extremities, and you will not see any fasciculus cuneatus in the lumbar, nor are you going to find it in the sacral. What the gracilis does, it carries proprioceptive information, for the lower trunk and lower extremities. That's the fasciculus gracilis. Now notice how you have gracilis in the sacral, you have it in the lumbar, you have gracilis also in the thoracic, you have gracilis in the cervical, okay? So cuneatus, you only have cuneatus in the cervical and in the thoracic segment. And it pretty much carries proprioceptive information back up the spinal cord. Remember, ascending tract is sensory, descending tract is motor. Now, aside from the posterior columns and the subdivisions, I want you to also understand that this diagram is summarizing everything on this side. These are the descending tracts, and these are the ascending tracts. Okay? So what I want you to focus on is, if you're looking at a diagram on a test and you have something like this, then you know that it's a descending tract. And as the name implies, lateral cortical spinal. Cortical meaning from the cortex of your brain and traveling down to the spinal cord, cortical spinal. Here, I want you to focus on the major ones, like the posterior spinal cerebellar, lateral spinal thalamic, which is this one here, this one here. You have your anterior spinal cerebellar tract, and you also have your anterior spinal thalamic tract. So these major ones, what I want you to be able to focus on or identify. So, and as the name implies, if it's spinal cerebellar, it's going from the spinal cord, traveling up to the cerebellum, up to the brain. So there's obviously an ascending tract. Okay? So you don't have to learn all these tracks, just pretty much be able to recognize this one in these tracks here and determine whether they are ascending or descending tracks and so forth. This is pretty much mapping out an ascending pathway that involves 3 neurons. Here's one. Here's a sensory ending. This is most likely a Pacinian corpuscle that you find in the dermis, right? So you have one neuron, there's another one, and a third neuron. So this is an ascending pathway going from the Pacinian corpuscle sensory path, going back up the spinal cord and to the cortex. Here, this is a descending pathway that involves 3 neurons. So you're going from the first order neuron from the cortex, right here, traveling down. Notice how in the area of the medulla, you now have a decussation. Decussation means crossing over of the signal to the other side, travels down, then hits another neuron, a second order neuron within the gray matter of the spinal cord right about here, and then you have a third order neuron that's going to make contact with the muscle fiber here at the myoneural junction. What I want you to get out of this slide, folks, is just to be able to recognize in these diagrams which pathway is which. This is an ascending pathway. This is a descending pathway. This is illustrating what's known as a reflex arc. Patient gets tapped on the patella, and by tapping the patella, the information goes to the sensory part of the this is sensory, this is motor. Okay, so it's going to go back to the dorsal horn, travel down to the motor horn, and induce extension of the knee. Here's a little video clip that pretty much animates that, and that you can watch at your leisure. This diagram, folks, this picture shows you how fragile we are, how fragile your spinal cord is. That an injury above this level here at about C7 will result in a person being quadriplegic. So an injury from here or above results in quadriplegia, and a spinal lesion from here below will result in a person being paraplegic. They can move their upper extremities, but below that they can't do much. Folks, and that concludes my discussion on the spinal cord. Thank you for watching. Goodbye.